On today's 2 on Your Side Town Hall, inside day one of the vaccination mandate for some healthcare workers. We're going to have a guest on to talk about what hospitals have been dealing with today, facilities all across New York State.
Plus, we verify the potential federal penalty for faking a vaccination card.
And a new FBI report gives us a sense of crime trends in the city of Buffalo. We'll take a look at the numbers, what they can tell us, and get some perspective from a former federal agent.
And thanks for being with us. Today is the day that a lot of hospitals and hospital workers have had marked on their calendars. It's the start of the state's vaccination mandate in certain healthcare facilities. We've
heard concerns for weeks that this could lead to serious worker shortages at a time when there is already high demand for employees in a lot of different industries. Well, here's what we can tell you as far as today. There are several lawsuits that are still pending right now, challenging several aspects of the vaccine mandates. The requirement for hospital workers, though, is in effect. The only change for now is that New York must accept religious exemptions thanks to one of the court cases. All along, the state has also accepted medical exemptions.
And at the same time, the state plans to bring in workers from outside New York to fill in the gaps, even potentially turning to medically trained members of the National Guard. And the big question right now is, how'd it go on day one? Well, we're going to bring in Patrick Weisansal II, who is Vice President of CWA 1168 and a CT technologist at Buffalo General Hospital. Patrick, thanks so much for your time tonight.
Thanks for having me.
To start out here, we know that it's been a busy day for you and hospital workers all over Western New York and the state of New York. What can you tell us about the experience that you either witnessed firsthand today or that you've heard from your union workers and your colleagues as to how it went today?
Today, you know, it really wasn't much different than what we usually see. We were prepared for a crisis in the hospital, but honestly, when we showed up this morning, nothing was really different. Staffing has always been at crisis levels. It was long before COVID, long before the vaccine mandate, and this has just really helped put a spotlight on the issue and put it front and center. And I just want to be clear, it's not just nurses, it's imaging technologists, pharmacists, pharmacy techs. It's all across the system from environmental to dietary.
It's interesting to hear the perspective, your perspective on this. And a few weeks ago, there were concerns about dangerously high numbers of staff being lost. And regardless of whether anyone thinks it's the right thing to do or not, did this mandate have an impact on those vaccination rates here?
I can only go off the reports that Kaleida Health has provided, CWA 1168. So about 5 weeks ago when we got reports, the vaccine rate was at about 81%. I'm happy to report and go off the numbers that Kaleida provided this morning, but 97% of the workers that are forward-facing at the bedside were vaccinated as of 7 a.m. this morning.
Has a two-part question for you. Has your union taken a position on the vaccine mandate? And I know that that's kind of a loaded question, right? Because theoretically, it may sound great and you may support it, but then there are also obviously consequences that come with that in terms of, you know, the staffing challenges that may follow. So number one, has your union taken a position? And then beyond that, what kind of challenges are you facing moving forward in terms of all of these staffing issues?
Yeah, so we haven't taken a stance. I mean, that's a personal decision for folks to make in their own homes with their families and whatever they'd like to do when they go home and really just make that decision. For us, it's always been about staffing. So we were prepared for a crisis. Like I said, staffing is still a crisis. We thought it would be much worse this morning. But for us, it was always, this is going to make things at the bedside worse. You know, healthcare workers are done saying, this is the best I can do. You know, I can't do any more. We need staff in the facilities. Folks are running around and looking for supplies, cutting towels in half to make washcloths. You know, we have folks who are going to be maybe walking out on strike on Friday at 6 a.m. In South Buffalo. And that should be really a pause for concern for the community, because healthcare workers are ready to run into a burning building. And nothing against our firefighters in the city, but when folks go out to the street and say, you know, we can't do this anymore, and they're ready to hit the streets and say, we have a big problem here, that should be a huge wake-up call for our families and our community and the people we serve, because we choose to go into healthcare to help people, and we're at the point where we feel like we don't have everything we need and we're not staffed to really do it anymore.
It's striking to hear the level of stress and just what is going on, but it's even more striking to hear you say that this is just shining a light on something that's been going on for a very long time. And I'm sure that there have been conversations about what comes next, not just in the immediate future, but down the road. So what are you hoping for, with maybe people having a better understanding, and what is the plan for the near future?
I think the biggest thing is we need staff in the facilities, and there's a lot of talk around the country and even locally about there's a healthcare worker shortage. There is no shortage. There is a shortage of folks who just physically and mentally, emotionally cannot do it anymore. And I think COVID and the epidemic has played into it a little bit and made it worse. But well before that, folks were burned out. We see nurses and imaging technologists and pharmacists and respiratory therapists who have a lot of experience taking care of the community, and they just cannot do it anymore. So you ask what we need. I don't know the answer, and it's not simply that there's not enough staff. It's recognition, it's respect on the job. It's for folks to hear their voices or have their voices heard, and be able to really have the supply so that when they go into work, they know they have everything they need to do their job. And folks just don't feel that. And it doesn't matter what healthcare system you come from in the area. We have folks at Catholic Health, we have folks at Kaleida Health, and that's really the common message we hear across the board nowadays.
Patrick Weisansal II is Vice President of CWA Local 1168 and a CT technologist at Buffalo General Hospital. Thanks for coming on today, and best of luck to you moving forward.
Thank you very much.